Hello, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone, and I'm so pleased to have here today David Goldhill. He is president and CEO of the Game Show Network, and he's also an author. The book is Catastrophic Care: How American Healthcare Killed My Father and How We Can Fix It. David, so great to have you here.
Thanks for having me.
Wow, what a title. I mean, that says a lot there. American Healthcare Killed Your Father. Can you take us back a little bit?
Yeah, my father died of a hospital-acquired infection. Had walked in, 82 years old, really for observation, and I think a series of medical mistakes resulted in, within 36 hours, his having the first of a series of infections that ultimately killed him. That was my first major interaction with the healthcare system. And obviously during that process, I'm thinking of the very personal elements of it. Somewhat later, when I realized how many people die this way, I thought, well, we're looking at something that's bigger than just the tragedy of my father's.
What do you think went wrong?
Well, I think we're looking at a system that probably doesn't have the same incentives for quality, safety, not to mention price, value, and all those other things that we see in the rest of the economy. And I think we as consumers and as citizens tend to give healthcare a pass. We tend to say it's so complicated and so important and so different from everything else that we shouldn't hold it to the same standards. And what I'm saying in my book is that I'm not sure that's right. I'm not sure that's not based on a conception of healthcare that may have been true 50 years ago, but really shouldn't be true for a 21st century healthcare industry.
Okay. If some other things had been in place, you believe your situation, your father's situation, could have been prevented?
Well, the crudest way I would describe it is, Medicare paid for my father's care. Can you imagine after a situation like this, if my mother had been the payer, the customer, my family had been the customer, that the hospital would even have tried to collect anything? Right now, the government, of course, and the payers are the partners of the healthcare system. If they don't pay for my father's care, they got to pay more for someone else's, is the way they look at it. Well, that distorts some of the incentives. The fact is, if you ask somebody to fix your car and he doesn't fix your car, you don't pay him. And it's a powerful incentive to get things right. And a lot of those powerful incentives, those really irrational consumers saying, no way I'm paying you for this, don't exist in healthcare.
Okay, so do you think that we should change and not cover everybody for everything?
Well, that is exactly the argument. I would like to see us build a true, simple safety net for everybody in this country that covers us against catastrophic illness, the things that really can disrupt your lives, both from a medical point of view and a financial point of view. But I think it's time to recognize that all of us use a lot of healthcare all of the time throughout our lives, not just when we're ill and not just when we're catastrophically ill. And that the idea of insuring all of that doesn't only create all the cost of insurance and the distortion of insurance and all the other financial problems with insurance, but takes us out of the system as customers. Mm-hmm. And customers exercise a lot of discipline in almost everything else we do other than healthcare.
Mm-hmm. Well, we certainly saw the passing of the Affordable Care Act. It's going on 3 years now. Are we headed in the direction that you'd like to see?
We are, but accidentally. Right, the Affordable Care Act, I think, is somewhat nostalgic. Right, it's an effort to address the old insured-uninsured divide, which I'm not sure was really the key healthcare divide in this country anymore. It's about finding the silver bullet in healthcare. It's about using whatever financial engineering necessary to expand the insurance system. It's about trying to centrally drive changes in innovation, in quality and safety and all these other things. I don't think that's going to work. But the good news is that because so much of the Affordable Care Act is so complex and creates so many unanticipated consequences, we're seeing the emergence, again accidentally, of a consumer sector in healthcare. We're seeing consumers make better choices and having to make choices, and we're seeing providers having to cater to those.
And we're also seeing fee for outcomes versus fee for services.
And I think what we'll see—
That should be a good thing?
I think to me, the best possible thing is almost the opposite of what we believe in healthcare policy. The more different things we try at the same time, the more likely we are to find things that work. The more we let competing business models, care models, paying models exist side by side, the better a chance we have for improvement. Only in healthcare do we say there should be only one way to pay for something, only one way to treat things, only one way to manage the relationship between provider and patient, seller and customer, if you will. That in itself is a mistake. Because a lot of good ideas, a lot of truly great and disruptive ideas, are about completely changing relationships. Hard to exist when you've built this big system that says there's only one way to pay for things.
How has the writing of this book changed what you do and how you look at what you want for care for your family?
It's a really interesting question. I think in the last few years I've become aware that quality of care is quite varied, and that just because you pay more, I mean, I live in Manhattan, which is a very high cost healthcare area, and there are some very famous doctors who charge a lot of money. That's no guarantee of better outcomes, no guarantee of better quality. We're strangely obsessed with money in healthcare, probably because we'll never have enough of it.
Well, people believe if they pay more, they'll get better.
That's right, and that what's missing is the ways in which we can judge real value, quality, safety, as well as price, that exist in everything else, doesn't exist in healthcare. The interesting thing about having a non-consumer driven healthcare business, which is what we have now, where the intermediaries are the customers, insurers, not us, is that we as customers have to work much harder to find out what's good, what's reasonably priced, what's safe. And so yes, I've become aware, if I'm going to be, look, I dealt with this with my son's recent appendectomy, I had to be a very active customer in finding the safest, best possible treatment for him, and wasn't fully successful at doing so, candidly.
And this was after what happened to your dad?
This was several years after what happened to my father.
So,
it was just a few months ago, a couple of months ago.
And so what had you learned from, were you able to navigate the situation?
Well, it's interesting. One of the things I was able to do, he needed some follow-up treatment because of a follow-up infection. I looked at I'm a member of the board of Leapfrog, and we publish hospital safety grades. I looked at the safest hospital in the region and went there. Went out of my way to do that for his care. But you can really see, one of the things I joke about, but it's not a joke, is that almost any hospital will say, you got a loved one, particularly a child, best if you're there at all times. Not to keep them comfortable, but to make sure the hospital doesn't make mistakes, knows who your kid is, right? And I always joke how, can you imagine going into FedEx and having FedEx say, we'll get your package there. Really best if you stay with it at all times while it works its way through our system. Well, that's what we say in healthcare. And in this century, it's crazy. And I think part of being a good consumer patient is not giving things that make no sense a pass. There's some things that are unavoidable, they're built into the system, it's going to take a while to change. But there are a lot of things you say, you know what, I'm not going to accept that as an answer.
So we should continue striving for greater transparency.
Greater transparency would help in all the ways in which not just consumers, but also outside services can look at data and say, here's a hospital that's great at this but bad at that, would really help us as consumers. If we can't drive prices, at least drive quality.
Okay, we're going to leave it there. Thank you so much, David.
Thanks for the time
really
today.
Appreciate your time.
Thank you.
And I'm Mabel Jung. Thank you so much for watching.